So with squirrel, and when you go to externally rotate, so we've taught to do external rotation mode to help with this, right?
Yes.
Is this a functional rotation unless you're a thrower? No.
No.
This is functional external rotation. Does my clavicle flip back in this position? No. No, right. I gotta figure out how to get them to teach this differently. There is an actual shearing component right here. So what happens is as we go back, they both go in external rotation, and then my acromion actually slides a little bit further back.
Can you show that on the skeleton?
Yeah. Even though this guy's pinned. So see, when you go to external rotate, see how the whole thing comes back, right, with retraction?
Yeah.
But there's a relative more external rotation glide coming from the AC joint. So it's this,
Ah.
right? So there's a shear. Sometimes we lose that shear. Think of people that have been stuck like this for years. Think about falling. Think about trauma. We lose that shear. So when they go to externally rotate, they go, it hurts back here. It's a pinch. That's because this thing's stuck. And another way to have them go like this, and this is what everyone does. I kid you not. I'm like, I tell my patient, like, I want to put your arms down and do this. They go,
Oh.
no. I go, okay, but now keep your elbows down to your side and open. And see if you see an oblique, and you'll see this usually.
Mm.
And you know, so that's telling you that this is probably stuck. So what you want to do is just move it. So Maddie's, you don't want to be, if you're down here, that's tender. You're on the biceps. You're actually going to follow it up. So you find that little divot right here. There's your acromion, and here's your clavicle. All I'm doing is going to push the clavicle forward and pull the acromion back. And it's not a huge pull, is it? And then the mobilization I do with it is like,
Whoa.
I'm like, hey, I want you to just kind of give me a little backhand. And normally I'll be right out here, and so I'll just have a touch like that, and I'll be, okay, go, and that's it. And then I'll get a little further. I'll get my hand out, great reach. So all of a sudden her whole arm just comes back with it. Then what I'll do is I'll stick my thumb back here because it's part of the scapula, right? So I'm going to stabilize that clavicle. I'm going to grab the acromion and I'm just going to palpate the rest of the clavicle right over the spine and retract the whole scapula. There, Maddie, there. It's not a huge motion, is it, Maddie? No, that's my retraining component, right? So that's just a way to recreate the shear at the AC joint.
Ah.
So this is, again, I know it's a palpation lab, but this is a little bit of a treatment. Because, I wish someone had showed me this at the beginning. It would have saved me years of headaches. So posterior pinch, what's happened is that this gets stuck, the glenohumeral joint rotates way too much, and it pinches the capsule in the rear.
Okay.
So remember, where pain is and where it comes from are two different things.
Yes.
Okay.